Committee members, including those who are recognized for questions while the vote is ongoing, will have sufficient time to step out of the hearing, cast their vote, and return to the hearing. We will begin this hearing in just a moment when they tell me they are ready to begin the live stream. Ladies and gentlemen, we are having some audio problems with the live stream, and we're trying to get that straightened out before we begin. Good morning. I think we've gotten it straightened out. Ladies and gentlemen, our nation is in the midst of a public health catastrophe. As of this week, more than 150,000 Americans are dead from the coronavirus, by far the most of any country in the world. As the virus is still spreading rapidly across our country, it took nearly 3 months for the United States to go from 1 infection to 1 million. Now, we're at more than 4 million, with at least 1 million Americans infected in just the last 2 weeks. Hospitalizations and deaths are unacceptably high. Hospitals in some states are at risk of running out of beds. It took nearly 3 months for the United States to go from 1 infection to 1 million. Now, we're at more than 4 million, with at least 1 million Americans infected in just the last 2 weeks. Hospitalizations and deaths are unacceptably high. Hospitals in some states are at risk of running out of beds, and some hospitals have reported that they may be forced to choose which patients to treat and which to send home to die. On our current course, experts predict another 150,000 Americans could lose their lives from the coronavirus by the end of this year. My goal today is simple: to hear from our nation's top public health experts on what steps we need to take to stop the unnecessary deaths of more Americans. To improve our response, we need to identify and correct past failures, especially those that are ongoing. Regrettably, nearly 6 months after this virus claimed its first American life, the federal government has still not yet developed and implemented a national strategy to protect the American people. The administration has failed on testing. While they were given warnings, including from this committee, that millions more tests were needed. At least 11 states, including my home state of South Carolina, are currently conducting less than 30% of the tests they need to control the virus. With state cases surging, states now face severe testing shortages. Wait times for results are a week or longer in many places, and some states have been forced to ration scarce tests, limiting them to only the sickest patients. Without widely available rapid testing, it is nearly impossible to control the spread of the virus and safely reopen our economy. Yesterday, it was reported that back in April, the administration considered implementing a national strategy to coordinate the distribution of test kits and contact tracing infrastructure, but it decided not to do so because at the time, the virus was primarily spreading in blue states. Since the earliest days of this crisis, the Trump administration has also refused to call on Americans to take simple steps to stay safe, like wearing a mask and social distancing. Instead, the president has downplayed the severity of the crisis, claiming the virus will disappear, sidelining government experts who disagree and seek to legitimize discredited remedies. When the public health agencies contradicted the White House's political message, for example, when the CDC warned that fully reopening schools presented the highest risk for spreading the coronavirus, the White House pressured the agency to change their advice. The result of these decisions is that the virus has continued to rage out of control, and our nation's economic misery has continued. And that brings us to today's hearing. It is clear that the administration's approach of deferring to the states, sidelining the experts, and rushing to reopen has prolonged this virus and led to thousands of preventable deaths. In fact, the United States response stands out as among the worst of any country in the world. My question is, where should we go from here? Today, I am calling for the administration to finally give America a comprehensive national plan that prioritizes science over politics. That plan should include buying and distributing enough tests and protective gear for every American who needs them. And it should include clear public health guidance to every American to help curb the spread of the virus. I am looking forward to hearing from our panel what common sense steps we can take as a country to control this virus and how the administration's plans to accomplish this goal. Today's witnesses have long distinguished careers under both Republican and Democratic presidents. Public health is not a partisan issue, and I hope that all members of the committee will join me in seeking the best health advice for the American people, not fighting partisan political battles. We do not need to lose another 150,000 American lives. But if we do not make drastic changes now, this tragic outcome is well within the realm of possibility. The chair now recognizes the distinguished ranking member for his opening statement.
Thank you, Mr. Chairman, and thank our witnesses for being here. Before I open, I do want to mention, Mr. Chairman, this is our first meeting that we've had since the passing of our dear friend and colleague, John Lewis. I know you personally were friends with him for roughly 60 years, and we all feel that loss. Very fitting tributes yesterday, and he was a dear colleague, but he was also a key important part of the movement that has made America an even greater nation. It's very fitting that our country has been paying such a great tribute to a dear friend and an icon in the civil rights movement, our friend John Lewis. Thank you again, Mr. Chairman, too, for having this hearing. I want to thank the witnesses, and I also want to thank your teams, because you represent what is on the front lines of President Trump's plan to combat the coronavirus crisis. For anybody to suggest that there's not a plan, in fact, when you look at the title of today's hearing, Urgent Need for a Plan, that's not the title of a hearing, that's a political narrative, and a false political narrative at that. You wouldn't even be here today if there wasn't a plan, because you are the people tasked with carrying out the plan. In fact, if you were sidelined, you wouldn't be here either. And I know some people want to suggest that, but maybe they haven't spent time reading different components of the plan. These are just a few, by the way, a few of the documents that your agencies have published to show states how to safely reopen, to show schools how to safely reopen, to show nursing homes how to care for their patients, which, by the way, if all governors would have followed those guidelines, thousands more seniors in nursing homes would be alive today if just 5 governors would have followed your plan that was developed by President Trump and is being carried out by you and your teams effectively every day. So again, let me thank you on behalf of the millions of American people who are alive today that wouldn't be alive if you weren't carrying out President Trump's effective plan to keep Americans safe as we learn about this virus, as we work to get a cure for this virus. And by the way, the cure, Operation Warp Speed, is part of President Trump's national plan, and I think we've all seen just how close we are to a vaccine, which is revolutionary in modern time. To be this close to a vaccine, we wouldn't be here that close to a vaccine without President Trump's leadership and without the work of you and your teams to carry out that plan. So again, I appreciate the work that you continue to do. Every day we learn more about a plan, like any plan, whether it's a military plan or a football plan. You start the first play with a plan, and then the plan has to change as things change along the way, and we're seeing that play out daily. When you look at the work that's been done, I think we talk about different parts of the guidance. We've not always been in agreement on each part of them, but we've had a number of hearings where we've talked through how to improve testing. In fact, one of the first hearings we had in this committee on testing was back when America was maybe conducting less than 200,000 tests a day. Today, because of the work that y'all have been doing and because of the President's plan, we're at over 800,000 tests per day, and that number continues to grow. Nobody's stopping, nobody's resting on their laurels, but when you look at that trajectory, again, going from a virus that no one even knew about just 6 months ago, China lied about during that period, where we could have learned a lot more, where we could have saved more lives while China was lying. I wish we would have hearings on that, because that is a real fact. That's not a political talking point. We all know not only did China lie, they corrupted the World Health Organization, and they were perpetuating that as well. It made it harder for us. I remember being in a meeting at the White House with Dr. Fauci months ago, before it was a global pandemic, and we were talking about the desire to get some of our medical experts into China to find out what was really going on, and they wouldn't let you in. The Chinese Communist Party wouldn't let you in when President Trump wanted to send medical experts into China before it spread into the United States, and that caused lives. Why aren't we having a hearing about that? Clearly, we talk about some of the other different things that were done to stop the spread. This president actually did develop an early plan called 15 Days to Stop the Spread. It was one of the first real organized plans to encourage states to pull back. It wasn't an easy plan for the president to have to issue, but it was necessary. And in fact, there were meetings in the White House. I think Dr. Fauci and Dr. Birx were there as that plan was being carried out, that you determined maybe we need to go longer, to go 30 more days. And in fact, by going 30 more days, you could save 1 million, maybe 2 million more lives. And then President Trump announced that plan and did save those lives. The Trump administration then released a plan called Guidelines, opening up America again, on how states could safely reopen. That's this part of the plan, by the way. Maybe some people are so busy reading tweets that they haven't actually read the plan. It's really good guidance issued by some of the most recognized international experts on disease prevention. Some of you here today represent parts of this plan. And so in opening up America, again, showed how states could safely reopen. The plan was developed by public health experts. Some complained that President Trump didn't have the power to force states to reopen. So the administration actually released guidelines so that states had discretion. Each state, we all understand how the 10th Amendment works. Each governor is in charge of their state. Nursing homes are actually regulated by the states, not by the federal government. But we give guidance, and it's been really good guidance. And in fact, that guidance has saved lives. We hear cities, and we hear people talking about the cries of the need for testing. So let's talk about what HHS has done to lead on testing. 0 tests. Again, go back a few months ago, 0 tests to now over 800,000 tests a day. In a matter of just months, over 52 million tests have been conducted nationally. And again, nobody's slowing down. We're actually increasing that number. We will be over 1 million tests a day. Maybe we'll have a hearing on how much progress we've made there, and we want to continue to make progress. I know Dr. Giroir was in Baton Rouge with me just a few weeks ago with the Vice President talking about what we're doing to increase testing, even to limit the number of days as a goal to get below 7 days for anybody to get results. And that number has narrowed dramatically. Now more than half of Americans who get tested get their results in less than 24 hours because of the rapid work that this team has done carrying out the President's plan. Testing is not just about numbers. It's about targeting testing to the right people at the right time. To that point, the Trump administration's begun distribution of rapid point-of-care tests to nursing homes. I've talked to nursing home heads recently who said that decision by the Trump administration to purchase an actual testing kit for every single nursing home in America, over 15,000 nursing homes, each of them will have their own 15-minute test. That will save lives. That's part of this plan. On May 15, 2020, President Trump announced Operation Warp Speed. Again, part of a very directed national plan to combat this deadly virus. Operation Warp Speed is a public-private partnership between several federal agencies to accelerate the development, manufacturing, and distribution of a COVID-19 vaccine, as well as therapies, diagnostics, other things to direct the specific goal of delivering 300 million doses of a safe, effective, FDA-proven vaccine for COVID-19 by January 2021, and we're seeing that happen at remarkable speed. In fact, we're not just going to wait for FDA approval. They're mass producing those vials right now so that if there is one of those vaccines approved by the FDA, it's ready to go. We don't start manufacturing at that point and cost us more weeks. We're actually ready to go. By the way, some of that money was money that we passed in the CARES Act that President Trump has used effectively to be ready as the vaccines are being developed in testing phases. Dr. Fauci, I look forward to learning more about the stunning progress that we've seen researchers make on cures and vaccines. I know you've been involved in researching some of the most awful, deadly viruses that we've known in the history of the world. HIV, Ebola, of course now Corona. We still don't have a vaccine for HIV. There's been over 10 years of work, and you've done remarkable work to at least give therapy so that people can extend their lives, but not a proven vaccine for so many of these diseases years and years later. And here we are 6 months into Corona, and we are this close to a vaccine. So you look at where we've seen the Chinese government. We hopefully will get into conversations about how costly it was, how many lives were lost because the Chinese Communist Party lied to the world, not just the United States, but the world, getting the World Health Organization to give false information in those critical early days. But why don't we now talk about moving into August? A lot of work is being done to talk about how to safely reopen schools. In fact, more guidance was just given as part of this plan by CDC to safely reopen schools. We saw, of course, the American Academy of Pediatrics gave great guidance on how to safely reopen school, and let every state for sanitizer, for masks, for all the things you would need to safely reopen. It's not about money, it's about the will, the desire to do it. We have the will, you've had the will, you have been carrying out the President's plan. Every day we will learn more. Every day we will continue to strive to address the new challenges, but let's not forget the things that have already been done as part of this plan that have saved millions of lives. We mourn every loss, but let's also recognize the lives that would have been lost if you weren't on the job carrying out President Trump's plan to contain this, to find a vaccine, which we're on the brink of, and to help safely reopen our economy, safely reopen our schools so that we can get back to our way of life as we combat this deadly virus. With that, I look forward to hearing from our witnesses. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Ranking Member. I would now like to introduce our witnesses. Today, the Select Committee is pleased to welcome Dr. Anthony Fauci, the Director of the National Institute of Allergy and Infectious Disease at the National Institutes of Health. We welcome back Admiral Giroir, the Assistant Secretary for Health at the Department of Health and Human Services. And finally, we welcome Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention. Thank you to all of our witnesses for being here today. Will the witnesses please stand so I may swear them in? Please raise your right hands. Do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? You may be seated. Let the record show that the witnesses all answered in the affirmative. Without objection, your written statements will be made part of the record. Dr. Fauci, you are recognized for your opening statement.
Thank you very much, Mr. Chairman, Ranking Member Scalise, members of the committee. Thank you for giving me the opportunity to discuss with you today the role of the National Institutes of Health in a research endeavor to address COVID-19. Our strategic plan, which we put together several months ago, embarks on 4 separate points. The first is to improve fundamental knowledge of the virus and the biology of the virus and the response to the virus. This has led to a delineation of the cryo-EM structure of the famous now spike protein, which is the target of virtually all of the vaccines that are being produced today. In addition, to delineate the nature of the receptor in the body to which the virus binds, very important in understanding the pathophysiology and pathogenesis. In addition, a number of natural history studies, including a study that was started in May to understand better the role of infection in children and what role they play in spreading a virus. In addition, we've been involved in the second component, which is the development of diagnostics and assays, one of which I'll point out to you is the NIH Rapid Acceleration of Diagnostics, referred to as RADx, including that is aimed at underserved populations, with a very large investment of money to develop point-of-care diagnostics to facilitate even more our diagnostic capability. Next is the characterization and testing of therapeutics. It is well known now that over the past several weeks, there have been 2 therapeutics that have passed randomized placebo-controlled trials for individuals late in the course of disease. One of these is remdesivir, a trial run by the NIH, which showed a statistically significant improvement in the time to survival in individuals who are hospitalized with pulmonary disease. That has now been part of the standard of care in individuals with moderate to advanced disease. In addition, a placebo-controlled randomized trial of dexamethasone showed an improvement in death rate in a highly significant manner in individuals on respirators as well as those requiring oxygen. And then finally, the development and testing of effective vaccines. Several months ago, we put together what we call a strategic approach to COVID-19 vaccine research and development. And the reason we did this is because there are multiple candidate vaccines that are moving along at a very rapid pace. And we wanted to make sure that they learn from each other. So we made standardized protocols, common data and safety monitoring boards, common primary and secondary endpoints, and common individual laboratory tests. There are 3 separate platforms that are being pursued with government help: nucleic acid, including the mRNA of Moderna, viral vectors such as adenovectors and VSV, and protein subunits. One of these is a trial that started last Monday, this past Monday, the 27th, to beginning in a phase 3 trial. It's a trial that will go over several months involving 30,000 individuals. We hope that as the time we get into the late fall and early winter, we will have, in fact, a vaccine that we can say would be safe and effective. One can never guarantee the safety or effectiveness unless you do the trial, but we are cautiously optimistic that this will be successful, because in the early studies in human, the phase 1 study, it clearly showed that individuals who were vaccinated mounted a neutralizing antibody response that was at least comparable and in many respects better than what we see in convalescent serum from individuals who have recovered from COVID-19. As I mentioned, the phase 3 trial has already started. 30,000 individuals, we are already starting to enroll. I might also conclude, members of the committee, to point out that there is a website called coronaviruspreventionnetwork.org where individuals can actually indicate their willingness to participate in the clinical trials and to make sure that we have a diverse representation. Already, as of last night, there have been over 250,000 individuals who have registered their interest in being in these trials. And I just want to use my last couple of seconds to urge anyone who's listening who wants to participate to please go to that website and register so that you can be part of the solution of this terrible scourge. Thank you, Mr. Chairman.
Thank you very much, Dr. Fauci. We will now hear from Dr. Giroir, or Admiral Giroir.
Both are fine. Chairman Clyburn, Ranking Member Scalise, and distinguished members of the committee, it is good to see all of you again. Testing is an essential component of America's public health response to COVID-19. Testing enables clinical decision-making. It heralds impending outbreaks. It informs resource allocation, and it assists in minimizing economic and social disruption. But we cannot test our way out of this or any other pandemic. Testing does not replace personal responsibility. It does not substitute for avoiding crowded indoor spaces, or washing hands, or wearing a mask. A negative test does not mean that you won't be positive tomorrow. A negative test does not substitute for avoiding crowds, or wearing a mask, or protecting the vulnerable with your actions. All of that being said, as of this morning, the nation has performed over 59 million COVID-19 tests, now averaging over 820,000 tests per day, up from 550,000 tests per day when I appeared before this committee just earlier this month. Since March 12th, we have increased our daily testing over 32,000%. Half of these tests are done in either point-of-care technologies with results in 15 minutes or less, or at local hospitals for which the turnaround time is generally within 24 hours. Because of unprecedented demand, large commercial labs that do approximately half of the nation's testing have become strained. But because of expanded capacity and newly authorized techniques like pooling and novel extraction methods, turnaround times are definitely improving. This week, LabCorp announced turnaround times of 2 to 3 days. But numbers don't tell the complete story, because this is not only about numbers, It is about getting the right test at the right time to the right person with timely and actionable results. So we will continue to execute in accordance with our national testing plan. This plan was initially outlined in the testing blueprint, Opening Up America Again, and the addendum to that blueprint. It was operationalized in the federal requirements for each state's testing plan. Our plan was further detailed in the administration's testing strategy report provided to Congress on May 23rd. In short, we are 1, identifying newly emergent outbreaks early to facilitate swift community action. 2, diagnosing COVID-19 rapidly in hospitalized patients to accelerate receipt of those proven treatments. 3, protecting the vulnerable, both the elderly and high-risk racial, ethnic, and socioeconomic minorities. 4, enabling identification and isolation of those who are infectious, coupled with contact tracing. 5, advancing state testing plans to achieve overall national objectives, as well as state-specific goals. And 6, supporting safe reopening of schools and businesses through surveillance testing that does not impinge upon the clinical diagnostic system. With the limited time I have remaining, I want to highlight 2 of these objectives. Protecting the elderly has been, is, and will continue to be a foremost priority for this administration. So on July 14th, we announced that every single nursing home in the nation would receive a point-of-care instrument and enough tests for their residents and staff to be tested. We are delivering on this promise. By the end of this week, we will have delivered, according to schedule, nearly 1 million point-of-care tests to 1,019 of the highest-risk nursing homes, with another 664 nursing homes scheduled for next week. My next point is about surveillance testing. We should separate the clinical diagnostic system from the public health surveillance system. Diagnostics are for those who are hospitalized, symptomatic, or with high-risk exposures. Surveillance testing can be for college students, or potentially students in K through 12, or workers in environments that are not high risk, or other similar situations. This type of surveillance can occur in non-CLIA labs, like university research labs or veterinary diagnostic labs, outside of the FDA authorization system at low cost and very high throughput. We are working closely with states and universities to implement this type of system, and many of them, like LSU, already have. We have all the tools, the supplies, and the regulatory framework to enable a robust surveillance system throughout the nation. In closing, we know how to flatten the curve, slow the spread, and save lives. Wear a mask, practice physical distancing, avoid crowded indoor spaces, practice good hygiene by washing your hands frequently. If you feel sick, stay at home, and protect the elderly and vulnerable populations of all ages through your actions. I look forward to your questions, and thank you for the opportunity to provide these remarks.
Thank you, Admiral Dr. Giroir. Dr. Redfield.
Good morning, Chairman Clyburn, Ranking Member Scalise, and members of the subcommittee. Thank you for the opportunity to be here today with my interagency colleagues. On behalf of CDC, I want to extend our deepest sympathies for the loss of our nation's esteemed Georgia Congressman and your colleague, John Lewis. Our nation will remember him for his courage, his conviction, his patriotism, and his commitment to equity for all. CDC also remembers him as a fierce advocate for public health. Working together, we are positioned to honor his lifelong commitment to social justice by advancing health equity and mitigating the negative impacts of racism on public health in our nation. The 3 of us here today are united in delivery of critical initiatives to stop the spread of COVID-19, to gain the upper hand on this pandemic in the United States, and to protect all Americans, while dedicating even greater attention to overcoming the health disparities experienced by populations at increased risk for this disease. We are 7 months into this global pandemic, and it is with great humility that I share with you, this is the most complex public health response this nation has undertaken in more than a century. This virus is indiscriminate regarding whom and when it strikes. We continue to learn its characteristics, its behavior, and its effect on Americans across socioeconomic spectrum. We are operating in a highly dynamic environment. We are adapting evidence-based strategies and pushing for innovative solutions to confront this unprecedented public health crisis. While I'm optimistic and look forward to discussing the promise of the COVID-19 vaccine, I want to strongly emphasize that we are not defenseless now. We have powerful tools, and if all of us, not just some of us, but all of us embrace these tools, we will get a handle on this pandemic. I am appealing to all Americans to be part of the public health solution. Wearing a simple mask properly, it's critical to limiting the transmission. Be smart about social distancing and being in crowded spaces. Stay 6 feet apart from others if possible, and be vigilant about hand hygiene. And together, we can turn the tide of this pandemic. With emergency funding, CDC has distributed more than $12 billion to the state, tribal, local, and territorial health departments to begin building the public health infrastructure this nation needs, but more importantly, that our nation deserves. This system has been underinvested in for decades and needs to be put on a path for sustained funding now. Data modernization is underway to ensure real-time actionable data and data analytics and to include predictive data analysis. Public health labs are restructuring, instituting the necessary resilience to rapidly respond to emergencies. Public health talent is being hired to enhance lab capacity, deploy cutting-edge technology solutions, and conduct effective community-based contact tracing. A legion of public health care workers are deployed on the front lines of this pandemic and working 24/7 to protect the health and safety of Americans. CDC staff are on the ground in communities across the nation supporting public health partners with an array of technical expertise. Our state and local partners are committed to advocating and educating about the needs to embrace public health strategies that best serve families and their communities. And essential workers, first responders, and healthcare professionals are steadfast in their service, sacrifice, and commitment to save lives. Please take note and please tend to them as they are tending to us. We cannot afford to do it without them. As I recently told a group of CDC aspiring leaders this week, we are in the arena. We're dedicated and committed to doing our best. And I'm confident that united, we will emerge a better, stronger, and more resilient nation. Adversity requires all of us pushing harder, thinking differently, being innovative, and perhaps most importantly, always seeing the possible of what we can accomplish when we unite and work together. This pandemic has challenged us with its persistence, its uncertainty, and its unpredictability. And yet I'm confident that together we'll prevail over this virus. But we must lead together in the best interest of our children, our grandchildren, our great-grandchildren, and our nation's generations to come. Thank you, and I look forward to your questions.
Thank you very much, Dr. Redfield, and thanks to all of you for your testimonies. And as I said earlier, you've submitted to us fuller testimony, and they're all entered into the record. Now I recognize myself for 5 minutes for questions. On January 31st, 2020, exactly 6 months ago today, the Secretary of Health and Human Services declared the coronavirus outbreak, and I quote, a public health emergency for the entire United States. But rather than immediately bringing our nation together to tackle the problem, the Trump administration downplayed the crisis, ignored scientific experts, and deferred to states and the private sector to lead the response. Dr. Fauci, on March 11th of this year, you testified before the Oversight Committee saying, and I quote, it's going to get worse. I regret to say you were right. It did get worse. On March 11th, the country had confirmed just over 1,200 cases and 31 deaths. Today, we have confirmed more than 4.4 million cases, and we have just reached 150,000 deaths. There's a chart that I have up here. This chart compares the number of new daily coronavirus cases in the United States with those in Europe. It shows just how much worse the outbreak has been in the United States. Here's Europe, the little line here, the European Union. Here, the United States. And here's where we were on the way. We started going up, while the European countries, European Union, plateaued and is going down. Dr. Fauci, can you help us understand why? While Europe has largely contained the virus, the United States has seen a continued rise in new cases.
Thank you very much, Mr. Chairman. The answer to that question is really somewhat complex, but I'll try maybe to very briefly go through what I believe are at least some of the factors that were involved. If you look at what happened in Europe when they shut down or locked down or went to shelter in place, however you want to describe it, they really did it to the tune of about 95+% of the country did that. When you actually look at what we did, even though we shut down, even though it created a great deal of difficulty, we really functionally shut down only about 50% in the sense of the totality of the country, which means when we reached our peak, as they did, they came down almost to a low baseline, as you've shown very clearly. But take a look at what happened to our baseline. We came up, down, and then we plateaued at about 20,000 cases a day. So we started off with a very difficult baseline of transmission that was going on at the time that we tried to open up the country. And when we opened up the country, what we saw, particularly most recently in the southern states, was an increase of cases to 20, 30, 40, 50, and a couple of weeks ago it was up to 70,000 per day, and now it's down between 50 and 60. And the reasons for that are complex. There were some states that did it very well, and there are some states that did not. And when I say did not, I mean, we put out, as Ranking Member Scalise mentioned, the guidelines of a gateway, phase 1, phase 2, phase 3. Some were followed very carefully and some were not. And in those situations in which you were not, that led to the surging that you're showing on your chart there. And one of the reasons is not doing some of the things that Dr. Redfield mentioned in his opening statement: universal wearing of masks, avoiding crowds, physical distancing, et cetera, et cetera. So it's a complicated reason why those charts are that way, and hopefully, as we're going forward, we can turn those around, and I do believe we can, Mr. Chairman, by doing some of the fundamental things that we're talking about, 5 easy things to do that were mentioned by Dr. Redfield. Thank you.
Thank you very much. At the risk of going over my time, because of the votes on, what I'm going to do is yield to you, Mr. Ranking Member, for 5 minutes. When Ms. Waters gets back, I'll let her get in the chair so we can go vote. Okay?
All right, thank you, Mr. Chairman. And again, appreciate all of you being here. I know when we talk about President Trump's team that he has been relying on to help put together this plan, and like I said, this is just a small part of the plan. There are thousands and thousands of more pages online of various aspects of President Trump's plan to combat the coronavirus. But we have, of course, Dr. Fauci, Dr. Giroir, Dr. Redfield. We see Dr. Birx. There's a whole array of doctors, medical experts, best in the world, that are helping work with President Trump to develop this plan. Is that correct? If I could ask any of y'all, is that correct? By the way, were any of you sidelined from coming here? I know some people try to use that term. I haven't heard of anybody sidelined, but if any of you are sidelined, please share it, because I haven't seen that. Good to see all of you here. Dr. Fauci, let me ask you about some of the decisions that you worked with President Trump on, and the whole team did. I know when you go back to the beginning of this, the China ban was very heavily discussed. Were you involved in working with President Trump on deciding to ban flights from China.
Yes, I was.
Do you agree with that decision?
I do.
Do you think that decision saved lives, Dr. Fauci?
Yes, I do.
Do you agree with the decision when ultimately we saw spread in Europe, and then the president recommended that we extend that to Europe? Did you participate in that discussion?
I was actively involved in that discussion, sir.
Do you agree with that decision?
Yes, I do.
Do you think that decision saved lives?
Yes, I do.
Eventually, then, we saw the United Kingdom have an outbreak, and there had to be a tough decision made. Do we extend that to the United Kingdom? Were you part of that decision?
I was.
And do you agree with that decision as well?
I do.
Did that decision save lives?
Yes, it did.
When you look at the 15 days to slow the spread, initially it started at 15. Were you part of the decision to implement that decision?
I was very much involved in that.
Did that decision save lives, Dr.
I
Fauci?
believe it did.
Then when President Trump met with you and Dr. Birx to extend that another 30 days, do you agree with that decision that President Trump made to extend that?
Yes, I was very much involved, and I agree with it.
Did that decision save lives, Dr. Fauci?
I believe it did.
So I know we've heard a lot about disagreements. Clearly, there are many decisions made. In fact, there are many very internationally respected doctors that are involved in each of those decisions. Is that correct?
Yes.
By and large, would you say that you and President Trump have been in agreement on most of those decisions?
We were in agreement on virtually all of those.
I appreciate that. Now I want to ask you, Dr. Giroir, Admiral Giroir, on the testing that you've been involved in to help carry out parts of President Trump's plan. You just talked about over 1 million testing machines, 15-minute machines that will be brought into nursing homes across this country. I know ultimately it's going to be 15,000, I'm sorry, over 1,000 machines that are going to be delivered already. Is that plan in place and moving forward based on President Trump's guidance?
It is.
And that money, in part, was taken from the CARES Act, the bill that we worked with President Trump to pass in a bipartisan way through this Congress. Is that correct?
Yes, sir, that's correct.
And I've heard specifically from nursing home directors who have told me that this decision will save more lives in nursing homes. Have you heard the same?
There is no question. I don't think any single decision has had more positive feedback than that one.
And I know early off CMS put out guidelines back in March. These were just part of the many guidelines that CMS put out on guidance to prevent COVID spread in nursing homes. We know that 45 governors followed this guidance. 5 governors did not follow this guidance, and we saw in those states tens of thousands of seniors in nursing homes died who shouldn't have died. If this guidance was followed by those governors, do you think they would have saved more lives?
As I have testified here before, I think it's a very concerning practice to send an infectious person back to a nursing home.
Well, thank you, and I wish those governors would have followed the guidance that President Trump's team put out as part of a major overall plan. Now, Dr. Redfield, I want to talk to you about reopening schools. I know you've been very involved in this. CDC's put out multiple documents of guidance for safely reopening schools. Here, checklist for parents, checklist for teachers, guidance for K through 12 school administrators on the use of cloth face masks in schools. I know some people want to make that controversial. This is President Trump's plan, part of his plan, to safely reopening schools, talked about the use of masks. Here you've got school decision-making tool for parents, caregivers, and guardians. Are these all parts of the president's plan to safely reopen schools?
Yes.
Have you been involved in developing that with President Trump?
Yes.
Do you think that schools should safely reopen this fall with in-person learning?
Yes, I think it's important to realize that it's in the public health best interest of K through 12 students to get back in face-to-face learning. There's really very significant public health consequences of the school closure. So
well, for example, they lack the ability to detect child abuse that occurs and is detected often in schools. Do you know how much child abuse will not be detected if children aren't returning to the school?
Clearly, we're seeing less reporting of it, and again, I think it's a direct consequence of the school closures. Well, 7.1 million kids get their mental health service in schools. They get nutritional support, as we mentioned, from schools. We're seeing an increase in drug use disorder as well as suicide in the adolescents individuals. So I do think it's really important to realize it's not public health versus the economy about school opening. It's public health versus public health of the K through 12s to get these schools open. We got to do it safely, and we've got to be able to accommodate.
Well, I appreciate that, and I know we're out of time. I hope that these school systems follow President Trump and these great medical doctors' guidance and help those kids by safely reopening. With that, I thank our witnesses, and Mr. Chairman, I yield back.
I thank the ranking member. The chair now recognizes Ms. Maloney for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Ranking Member. And I want to thank all of our witnesses today, particularly Dr. Fauci, who was born in the great city of New York, in the beautiful borough of Brooklyn. New Yorkers are very proud that you were a New York raised and New York doctor before you became America's doctor. And I must say that, as the chairman mentioned, when we had our hearing on March 11th, which I was privileged to chair, when I asked you how is it going to go, you said it's going to get worse and worse and worse. And the next day, everybody started closing down, sports clubs, museums, and treating it with the seriousness that disease had to be treated with. And at that hearing, when asked about testing, you said, and I quote, that we're not really geared up to do what we need right now. In fact, you said, and you called it failing. Now it's 5 months later. Where would you rate us now in our efforts? I know my city and other cities have worked diligently trying to respond. Where would you put us now with testing? What do we have to do to continue to get better?
Well, I think you can get a more detailed response from Admiral Giroir, but I'll comment. I think that things are considerably different and improved now than it was several months ago, both for the numbers of tests that have been improved, as well as for the efforts that are going into to expand our capability. In other words, to more prudently have screening testing done in one segment, as well as testing to determine diagnosis and follow-up in others. But Dr. Giroir is much better qualified to give you the details of that.
But I would like to now move to vaccines. That's the challenge now. And I recall reading one of your reports on AIDS, and you said, I will never retire until we have a vaccine. We still don't have a vaccine for AIDS. Ebola took 5 years. How realistic is a vaccine? Is it dreaming, or is it a reality? Are the protocols as safe as they possibly could be for, as we've always had for vaccines? Could you give us an honest assessment of where our country is in vaccine development?
Yeah, it's reality, Congresswoman Maloney. I believe it will occur. I think the difference between HIV and coronavirus is so different that I don't think you can compare them, because the body does not make a very good immune response against HIV, so it would make vaccine development very difficult, whereas the body does make a robust immune response against coronavirus, which tells us that I believe that we can get to that goal. I know to some people this seems like it is so fast that there might be compromising of safety and in scientific integrity. And I can tell you that is absolutely not the case. The rapidity with which we're doing it is as a result of very different technologies in getting from the time we recognized this pathogen in the beginning of January to the time we were able to get into a phase 1 trial, to the time we were able to do phase 2, and then, as I mentioned, just this past Monday, we started a phase 3. That was not reckless rushing. That was technology and doing things in a way that does not compromise any of the steps. So I believe that it is realistic, as I mentioned in my opening statement, that the early data from the phase 1 trial shows that this candidate, and I'm sure other candidates will do it also. This is not the only vaccine. There are more than one. There are about a dozen, 5 or 6 that the federal government is actively involved with, is going into phase 3 trials over the next few months, as I mentioned, one of which is already in. The response that was induced was really quite favorable. And as I've said often, and I'll repeat it for the record now, there's never a guarantee that you're going to get a safe and effective vaccine. But from everything we've seen now in the animal data as well as the early human data, we feel cautiously optimistic that we will have a vaccine by the end of this year and as we go into 2021. So I don't think it's dreaming, Congresswoman. I believe it's a reality and will be shown to be a reality.
That's very good news. Second step is, how do we distribute it? And also, reports are that China and Russia are involved in their tests, and that they have advanced tests across the world. They're testing in Brazil, in Indonesia for their vaccines. Should they develop one earlier, would we manufacture it here? When we develop it, how do we plan to distribute it? We also have to think about the world. If we don't cure it in the world, then we haven't cured it too.
Right.
So the steps forward after the vaccine's developed.
Sure, there are a couple of questions. I'll try to answer them quickly, Congresswoman. So the first thing is I do hope that the Chinese and the Russians are actually testing the vaccine before they are administering the vaccine to anyone. Because claims of having a vaccine ready to distribute before you do testing, I think, is problematic at best. We are going very quickly. I do not believe that there will be vaccines so far ahead of us that we will have to depend on other countries to get us vaccines. I believe the program that is being sponsored by us right now and being directed and implemented by us is going at a very rapid speed, prudent but rapid. Now, with regard to distribution, already right now there are plans, as was mentioned, I believe, by Ranking Member Scalise, that we're taking at risk, financial risk, not safety risk, but financial risk, the development of doses of vaccine right now as we speak, so that they will be ready by the time we do show safety and efficacy, we'll be able to distribute it. And it will be done by a number of mechanisms, the standard mechanism working with the recommendation by the ACIP together with the CDC, now being complemented by recommendations from the National Academy of Medicine, and in collaboration with the Department of Defense and the CDC, working together, it will be distributed.
Thank you. My time has expired.
Thank you very much, Dr. Fauci. The chair now recognizes Ms. Walowski for 5 minutes.
Thank you, Mr. Chairman. Gentlemen, thank you for your service. Thank you for being here today. I think that arguably the most important thing the federal government is working on right now is ensuring, and I'm an optimist, and listening to you this morning, I'm still optimistic, that we're going to use the term when and not if when it comes to getting a vaccine shown through trials to be safe and effective, that we have manufacturing and distribution capabilities to go and get it across the nation quickly. I believe that. President Trump has already announced Operation Warp Speed to achieve the goal of delivering 300 million doses of an approved vaccine by January of 2021. It's leveraging the full strength of the public and private sectors, the partnerships that are there and becoming partnerships is unprecedented in this country, and I salute that. AstraZeneca told the Energy and Commerce Committee a few days ago that this deal with the federal government stipulates that it will sell 300 million doses to the government at no profit. Johnson & Johnson similarly said it will provide its vaccine at a not-for-profit price. Other companies working on vaccines have also promised low prices. Dr. Fauci, between the promises for low prices and existing government programs that cover the cost of a vaccine, is it safe to say that every American will be able to get a vaccine once it's approved?
Given what you've mentioned, which I agree with, the promises of the company about hundreds of millions of doses, I believe ultimately over a period of time in 2021, if we have, and I think we will have, a safe and effective vaccine, that Americans will be able to get it. I don't think that they will have everybody getting it immediately in the beginning. It probably will be phased in, and that's the reason why we have the committees to do the prioritization of who should get it first. But ultimately, within a reasonable period of time, the plans now allow for any American who needs a vaccine to get it within the year 2021.
Right, and that is the plan.
Right.
Staying on the topic of vaccines, Dr. Fauci, it's my understanding that Operation Warp Speed enabled clinical trials for the most promising vaccine candidates to be run simultaneously, which will get a vaccine to the market much faster than normal. My understanding from listening to you just a few minutes ago, we have eliminated no safety steps in the vaccine approval process, correct?
That is correct.
Correct.
That is correct.
Again, just to be clear, so the folks that are watching this are hearing this clearly, concisely, and truthfully from you. The FDA is not compromising safety standards in order to speed up vaccine process approval, correct?
Well, I would say it a different way.
Okay.
We at the NIH are doing the vaccine studies with the companies. The FDA will look at that data and on a science-based decision will make a determination as to the safety and efficacy and whether or not it will be approved. So the FDA is a science-based decision maker.
But as far as you know in that, I agree, but the FDA is not compromising safety standards.
No.
No way, no how. No way, no how is the FDA compromising safety standards.
No.
And their answers and their approvals are based on science.
Yeah. Historically, the FDA has based their decisions on science. They will do it this time also, I'm
I
certain.
appreciate it. Thanks for your assurances that we'll have a safe, affordable, and widely available vaccine for the American people. All of America is praying that one of these promising candidates comes through. That's why I'm so disappointed that we've seen some on the other side of the aisle speculate aloud that the administration might rush an unsafe vaccine to the market before the election to help President Trump politically. This irresponsible rhetoric only serves to plant irrational fears in the minds of Americans. I'm worried that enough of these types of attacks could result in people avoiding an approved vaccine when it does come to market, when it is available for Americans. Dr. Fauci, can you address this once and for all? Would the administration approve a vaccine that's not safe? And do you share my concern about the danger of undermining faith in the vaccine development process?
The Commissioner of FDA, Dr. Stephen Hahn, has assured me and has spoken publicly that he would make sure any decision on the part of the FDA will be based on sound scientific data proving the safety and the efficacy. He's told me that, and he's been very public about that. Given that, I think the American public should be assured that in the process of determining the safety and efficacy, the proper steps have been taken to determine that. And when a vaccine becomes available, it's important for their own health and for the health of the country to take that vaccine.
I appreciate that. Thank you, gentlemen. I can't let this moment pass without bringing to all of our attention again and to the chairman that just last week the Justice Department indicted 2 Chinese nationals for hacking companies that are working on a vaccine. We sent a strong message to China this will not be tolerated. I'm glad the administration took action by naming and shaming those involved, as well as closing down a Chinese consulate that was a hub for intellectual property and trade secret theft. We must hold China accountable, Mr. Chairman. We have to. Mr. Chairman, before I close, can you commit to holding a hearing on the threat of Chinese espionage on vaccine products, vaccine producers? Mr. Chairman, whoever's sitting in for Mr. Chairman, will you promise me that we will hold a hearing on the threat of Chinese espionage on vaccine producers?
The chairman is not here to answer the question. You have a few seconds left. Your time has expired.
Mr. Chairman, this is a grave threat. Record.
Thank you.
Mr. Chairman, this is a grave threat to our country and the world. If China is hacking our companies, I seriously hope the chairman will take my recommendation. I yield back.
Thank you very much. I will now recognize myself for 5 minutes. On July 10th, the Trump administration ordered hospitals to change how they reported hospitalization rates, testing numbers, and other data related to the coronavirus. Instead of reporting to the CDC, which hospitals have done for more than a decade, they were instructed to start reporting the data to the Trump administration directly, specifically the Department of Health and Human Services. They were given just 2 days to prepare for this drastic change. Leading health groups warn that the changes in data reporting will, quote, worsen our ability to mitigate, suppress, and recover from our national public health emergency, unquote. Other experts are concerned that this decision may have been made so the Trump administration could control and hide data it finds politically inconvenient. Dr. Redfield, when did you first learn that the administration planned to move the data from CDC to a different portal run by HHS?
Well, Congressman, we weren't directly involved in the final decision, but what I can say is that CDC then and now continues to have access to all data, does all data analytics, so there's no restriction of any of the data, and that data we continue to forward face the American public.
Dr. Redfield, when did you first learn? When were you first told? When were you first notified?
Again, as I mentioned, I wasn't involved in the decision.
So you were never
I don't remember the exact date.
Am I to understand?
I don't remember the exact date.
Am I to understand that you were not told at all?
Well, I was told, actually, once the Secretary's office made the decision, that that was the decision, and we worked together.
So how long was that?
I don't remember, but I can get back to you the exact date. But we
Okay.
did work in cooperation to help make sure that this was done
Reclaiming my time,
in an
did you
effective
agree
way.
with this decision, Dr. Redfield?
Again, I think it was an important decision in light of
Did you agree with the decision?
Yes, I said it's an important decision.
Thank you. Did you discuss this change with Vice President Pence or with Secretary Azar?
Not directly.
Indirectly?
I talked directly with the individuals responsible within the
So
Secretary's
did you
office.
discuss it with the Vice President Pence?
No,
Did you discuss it with Secretary Azar?
no.
Who told you about the reasons for this change?
Well, I think we collectively understood the reasons, if I can answer, is there were substantial advancements in therapeutics with remdesivir, which made it really important to be able to understand who was newly hospitalized in real time that day, so allocations of remdesivir to get to that hospital.
I thank you very much for that. And so you developed the reasons, no one dictated the reasons or told you the reasons for the change. You came up with the reasons?
Congressman, yes, I think it was important that we were able to, in real time, be able to know where remdesivir needed to go. And the system that we had developed, the National Healthcare Safety Network that we do for...
So were you told about the changes, why they were being done, or did you and others develop the changes? Who told you?
We work together
About the
cooperatively. We work cooperatively together, members of the HHS and CDC, in recognizing the importance of these changes.
Okay, I only have so much time. The Trump administration has threatened to cut off the supplies of remdesivir to hospitals that do not follow the new reporting mandates. Dr. Redfield, this is the only drug known to successfully treat the coronavirus. Should a patient be denied access to a potentially life-saving drug like remdesivir because a hospital was unable to comply with a sudden change in HHS reporting requirements?
My understanding is we continue to do everything to make sure remdesivir gets to all patients that would potentially benefit from it.
But do you agree that they may not be able to get them to patients because of the way that the information was given and the time frame that it was given in?
Congresswoman, I would disagree. I think the reason the changes were made was to assure that individuals could get access to remdesivir in a timely fashion.
Would you agree that we basically, well, this is the only drug known to successfully treat the coronavirus. Should a patient be denied access to a potentially life-saving drug like remdesivir because a hospital was unable to comply with a sudden change in HHS reporting requirements?
And again, I'm trying to say I think the intent and the consequence of what was done was to ensure that patients aren't denied access to remdesivir, to make sure we get timely distribution to the hospitals where these patients are.
Thank you very much. I've exhausted my time. Next, we will hear from Mr. Foster, I believe. Mr. Lukemeyer is next. Thank you. You are recognized for 5 minutes, Mr. Lukemeyer.
Thank you, and thank the witnesses for being here today. I appreciate your testimony and your expertise. Dr. Redfield, on Tuesday, July the 14th, you stated that right now, we're seeing, sadly, far greater suicides than we are deaths from COVID. We're seeing far greater deaths from drug overdose than are above excess, than we had as background, than we are seeing deaths from COVID. Since the pandemic began, alcohol sales have increased by more than 25%, and suspected drug overdoses have climbed 18%. I've said this almost every hearing. We need to make sure we're looking at both sides of this healthcare issue. We're targeting our approach right now to take care of those COVID, but we also need to make sure that we're looking at the severe unintended consequences like substance abuse, domestic violence, child abuse that are occurring due to the economic shutdowns that took place across the country, because these instances will likely be around far longer than the virus itself. So, Dr. Redfield, do you believe that the blanket shutdowns happening throughout the country are contributing to the drastic increases in substance abuse and suicides, the lack of cancer screenings and treatments and operations and other things like that, that we've sort of left out of the picture here as a result of our total focus on COVID?
Congressman, I thank you for the question. I think it's really important as we reopen America now that we're much more surgical about those situations that are curtailed. So as you mentioned, we clearly are consequences for the decrease in immunization in children. We're clearly consequences for the lack of cancer screening. There clearly were consequences for delayed surgeries that were elective that now are semi-elective. There clearly are consequences, substance abuse and mental health services. So it really is important as we reopen our nation that we really ensure that there's not these unintended consequences that I I think the reality is did occur during March, April, and May.
You know, there was an article that appeared in one of the local magazines with regards to trying to quantify that figure. And they did, and they came up with a figure of around 65,000 people per month that were dying because of the lack of health care that was either being postponed, denied, waived, whatever, versus our total focus on COVID. Dr. Fauci, I have watched a number of your press conferences, and I've seen you articulate a lot about COVID, but I've never seen you talk about this other part of the healthcare spectrum that we need to be considering also. Would you like to comment on that and give me your position on that, please?
Yes, I actually have commented on that when I've said, most recently talking about schools, that I think that a default position, despite the fact that we have to have flexibility, would be to try and, as best as we possibly can, in the context of the safety of the children and the teachers, to open the schools for the very reasons that I think you mentioned and that Dr. Redfield mentioned, because of the negative consequences on children from a psychological standpoint, as well as the downstream unintended consequences on families.
You know, one of the problems that we all have here on this committee is we're sitting here looking at the consequences of a problem that we have with COVID. We're looking at the consequences we have on not attending to the healthcare needs of the rest of society, and we have to sit here and figure out how do we manage this? How do we look at both sides of this? How do we, from 30,000 feet, make sure everybody is taken care of? In our position, what would you recommend, Dr. Redfield, on how we should approach this problem?
Again, I just want to echo what Dr. Fauci said earlier. We think that if you do 5 things, we can accomplish as much as we did as shutting down this nation. Wear a face covering.
All those things will be able to put us back.
We can put us back.
We can address the other part of this as well.
We can get back without these unintended consequences. The face masks, the social distancing, the hand hygiene, staying smart about gatherings, and staying out of crowded bars and crowded restaurants. If we did those 5 things, we've done modeling data, we get the same bang for the buck as if we just shut the entire economy down.
Okay. You know, you've commented quite a bit this morning already on the school openings, and your comment was, you know, it's not about the economy or public health, it's about public health versus public health. I've got some grandkids, and I want them to go back to school. I think for their own health we need to be doing that. I think you made the comment you have grandchildren, you'd like to see that happen as well. Would you like to comment on the other part of this again, the unintended consequences of the problems with child abuse that's not being reported, because a lot of it's reported by teachers. We've seen that go down. We've seen emergency cases in emergency rooms go up as a result of this. Can you comment on some of that, please?
Congressman, thank you. I just want to reemphasize, because I don't think I can emphasize it enough. As the director of the Centers for Disease Control, the leading public health agency in the world, it is in the public health interest of these K-12 students to get these schools back open for face-to-face learning. Mental health service, 7.1 million kids get it in school. Nutrition, we talked about. Reporting of child abuse, sexual abuse, mandatory in schools. The isolation that these adolescents are feeling that now is associated with increase, as you mentioned, increased drug overdose deaths and now increased suicides. I think it is really important. As a grandfather, 11 grandkids, I want these kids back in school. I have one grandchild with cystic fibrosis. I want it done smartly. All right, but I think we have to be honest that the public health interest of the students in this nation right now is to get a quality education in face-to-face learning, and we need to get on with it.
And one of the words I always use.
Thank you. The gentleman's time has expired. The chair now recognizes for 5 minutes Ms. Velasquez.
Thank you, Mr. Chairman and Ranking Member. Gentlemen, it has been 6 months since this crisis began, yet new infections are still climbing in many states. Many hospitals are at capacity, and thousands of Americans are dying. I am concerned about widespread delays in test results are contributing to this problem. In Arizona, the test positivity rate is over 20%, but test results there have been delayed by up to 16 days. In Florida, many hospitals in the state are near or at capacity, but results can take over a week. In Georgia, some companies have reported average processing times of 5 to 10 days. Dr. Fauci, You said in a recent interview, and I quote, "If you're going to do contact tracing and the test comes back in 5 to 7 days, you might as well not do contact tracing because it's already too late." Dr. Fauci, if a 5-day testing delay is too long, then is it fair to say that a 16-day delay is absurd? What are the consequences from these delays?
I believe you can get a more detailed answer from Admiral Giroir, but as I said before, that is a delay that would interfere with the effective contact tracing, and we're trying to decrease that. But the exact numbers of the delay, I believe that Admiral Giroir has more precise information on that.
Yes, sir. Admiral. What are the consequences from these delays?
Yeah, thank you, ma'am. So as I talked about half the tests are done either at point of care or within hospitals, which are pretty rapid. The current data we have from the large commercial labs are that 59% of all tests are reported within 3 days, 76% within 5 days, and I am sure there's an outlier at 12 to 16 days because that happens, but that's very atypical. And in the cities you talked about,
Sir, that is not what we are hearing from places like Arizona, Florida, and Georgia.
So I get the data every single morning from every single state and can tell you specifically what that is. And we have surge testing. We have brought federal resources to massively surge in Phoenix, and that's why it's totally gone down. In Miami, totally gone down, Jacksonville.
Reclaiming my time, Dr. Redfield, I would like to turn to you. Does the CDC have comprehensive information about the wait times for test results in all 50 states?
Sorry.
Does the CDC have comprehensive information about the wait times for test results in all 50 states?
I would refer that question back to the Admiral.
Sir?
Yes, we have comprehensive information on wait times in all 50 states from the large commercial
And do you
labs.
publish this data?
We talk about it whenever, always. I mean, I was
And you don't
I was
think
on,
that
I was
it
with
will be important?
I was with 69 journalists yesterday, and we talk about that frequently. So if you would like to see that, I'm very happy to do that.
Well, it would be great so that those that are making decisions at the state and city level, we have access to that information. Because it is important to understand the trends.
They do. They have that information. In fact, from the commercial labs, when they place an order, they're told exactly what the expected wait time is for that order.
So we cannot expect to reopen the economy safely if the virus is spreading unchecked. Testing, contact tracing, and isolation will not be effective unless we cut the turnaround time for tests. And I don't want to talk about Puerto Rico. That's another story. Chairman Powell said this week that the path of the economy is going to depend to a very high extent on the course of the virus and on the measures that we take to keep it in check. He said also that the Fed will use its full range of tools to steer the economy out of recession. Gentlemen, is the federal government using its full range of tools to get the virus under control like other countries have? Many states are reconsidering their reopening plans after experiencing a shocking increase in new cases and being unable to stop the spread. Dr. Fauci, what roles does the lack of sufficient testing and contact tracing play in states' inability to control the virus?
Testing and contact tracing is one of a number of tools that are used to control the kind of surging we've seen. But I would also like to point out, Congressman Velasquez, to reemphasize again what I said in my opening statement, that we could do a really good job of controlling it if we paid attention to 5 fundamental principles, one of which is what we're doing here,
right,
with masks, crowds, distance, bars, washing hands.
And
that is critical. Testing is absolutely an important part of it, and an important part of the process.
And I understand that, but the largest and most important pulpit is the one, Pennsylvania Avenue. It doesn't matter what you say, if what you said is undermined by the President of the United States.
The gentlelady's time has expired. The chair now recognizes for 5 minutes Mr. Jordan.
Thank you, Mr. Chairman. Dr. Fauci, do protests increase the spread of the virus?
Do protests increase the spread of the virus? I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking that number of
No.
people, does
Yeah.
it increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should government limit the protesting?
I don't think that's relevant to.
Well, you just said if it increases the spread of the virus, I'm just asking, should we limit it?
Well, I'm not in a position to determine what the government can do in a forceful way.
Well, you make all kinds of recommendations. You make comments on dating, on baseball, on everything you can imagine. I'm just asking you, just said that protests increase the spread. I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that. I can tell you.
Government stopping people from going to church, Dr. Fauci?
Yeah.
Last week in the Calvary Chapel case, 5 liberals on the Supreme Court said it was okay for Nevada to limit church services. Justice Gorsuch said it best. He said, there's no world in which the Constitution permits Nevada to favor Caesar's Palace over Calvary Chapel. I'm just asking, is there a world where the Constitution says you can favor one First Amendment liberty, protesting, over another, practicing your faith?
I'm not favoring anybody over anybody. I'm just making a statement that's a broad statement that avoid crowds of any type, no matter where you are, because that leads to the acquisition and transmission. And I don't judge one crowd versus another crowd. When you're in a crowd, particularly if you're not wearing a mask, that induces the spread.
It's a simple question, doctor. Should we limit the protests? Government is obviously limiting people going to church. And look, there's been no violence that I can see at church. I haven't seen people during a church service go out and harm police officers or burn buildings. But we know that, for 63 days, 9 weeks, it's been happening in Portland.
Right. Yeah.
Well, one night in Chicago, 49 officers were injured. But no limit to protests, but boy, you can't go to church on Sunday.
What was the,
I don't know how many times I can answer that. I'm not going to opine on limiting anything. I'm just going to tell you.
You've opined on a lot of things, Dr. Fauci.
Yeah, but I've never
This
said
is something
to
that
limit
directly impacts the spread of the virus, and I'm asking your position on the protest.
Yeah, I'm not going to opine on limiting anything. I'm telling you what it is, the danger. And you can make your own conclusion about that. You should stay away from crowds, no matter where the crowds are.
Government has stopped people from going to work. In fact, just in New Jersey 4 days ago, Ian Smith, Frank Trombetta were arrested for trying to operate their business, their gym. They were arrested. But my bet is if these 2 individuals who own this gym were outside just in front of their gym, and all the people who were working out in their gym were outside protesting, they'd been just fine. But because they were in the gym working out, actually running their business, they got arrested. You think that's okay?
I'm not going to opine on who gets arrested and who does not. You get where I'm going. I'm telling you, as a public health official, I say crowds.
Do you see the inconsistency, though, Dr. Fauci?
There's no inconsistency, Congressman.
So you're allowed to protest millions of people on one day in crowds yelling, screaming, but you try to run your business, you get arrested? And if you stood right outside of that same business and protested, you wouldn't get arrested? You don't see an inconsistency there?
I don't understand what you're asking me as a public health official to opine on who should get arrested or not. That's not my position. You could ask it as much as you want,
you've advocated for certain businesses.
You've
You've advocated for certain businesses to be shut down. I'm just asking you on your position on the protest. I haven't seen one. We've heard a lot about hair salons. I haven't seen one hairstylist who, between haircuts, goes out and attacks police or sets something on fire. But we've seen all kinds of that stuff during protests, and we know the protest actually increased the spread of the virus. You've said that.
I said crowds. I didn't say specifically. I didn't say protests do anything.
So the protests don't increase the spread of the virus?
I didn't say that. You're putting words in my mouth.
No, I just want an answer to the question. Do the protests increase the spread of the virus?
I don't have any scientific evidence that anything. I can tell you that crowds are known, particularly when you don't have a mask, to increase the acquisition and transmission. no matter
So
what
you
the
don't have a
crowd is.
position on whether the protests increase the spread of the virus or don't increase the spread of the virus?
I'm saying that crowds, wherever the crowds are, can give you an increased probability that there's going to be acquisition and transmission.
But do you understand Americans' concern? Protesting, particularly according to the Democrats, is just fine, but you can't go to work, you can't go to school, you can't go to church. There's limits placed on all three of those fundamental activities, First Amendment activities, but protesting is just fine.
You know,
the gentleman's time has expired, but I'll just ask the gentleman to just think about his question and put it in reference to crowds that gather at political meetings, at fundraisers without masks, on an oil rig in Texas, nobody wearing a mask, nobody social distancing, but a fundraiser.
Right.
Would that be problematic? With that, I'll yield 5 minutes to Mr. Foster.
Well, thank you, Mr. Chairman. Dr. Fauci and Dr. Redfield, I'm a scientist, as you are, and so you know how important it is that when a great scientific breakthrough reaches the public, that the proper credit is given, not to just those who show up and claim credit at press conferences, but to the long list of federally funded researchers who've made these breakthroughs possible. And also to the enlightened federal employees and the politicians who funded that research. I remember back a few years ago when we had newspaper headlines about all the miraculous cures in cancer immunotherapy, where I gave a floor speech in the U.S. House saying, yeah, this was great, but equally great were the decades of federally funded research and the researchers who made those clinical breakthroughs possible. And also, frankly, that some of the credit goes to the Democratic and Republican members of Congress who resisted the proposals for massive budget cuts to science that were proposed by Republicans for years in the Paul Ryan budgets and by the Trump and Mulvaney budget cuts since then. Now, in the case of the mRNA vaccines that have been so much in the news this week, the story does not start with Operation Warp Speed. It does not even start with a historic 63-day sprint from the publication of the viral genome to the first patient injected by the mRNA test vaccines. The sprint, I believe, began when President Trump, this sprint actually began when President Trump was still ridiculing the idea of the pandemic. The sprint actually started when dedicated employees at NIH and Moderna who understood the danger of COVID-19 and began working day and night. The story of federal investments in mRNA vaccines actually starts, I believe, back in 2009, when President Obama, who was at the time unhappy with the speed of response to the H1N1 swine flu epidemic, convened his scientific advisory panel, PCAST, which they did back in those days, and famously asked them, if you guys are so smart, how come you still make vaccines with chicken eggs? Okay, so 1 year later, in August 2010, PCAST put out a report on re-engineering vaccine production for pandemics, which emphasized the potential of new technologies to make vaccines and therapeutics available far faster in a pandemic. Heeding the advice of his scientific panel, which they did back in those days, in 2013, the Obama administration awarded a $25 million DARPA grant to a startup called Moderna to develop their mRNA vaccine platform for pandemic response. This was followed in 2015 by a $125 million investment by BARDA, so that by the end of the Obama administration, Moderna had mRNA vaccines and therapeutics under test in both animals and humans. So why is it that the Obama administration prioritized mRNA vaccines and therapeutics? Well, first off, it's their speed of development, which we saw realized in the 63-day sprint. It's the speed of manufacture, which has to do with the high yields of in vitro transcription reactions, and their potency. Scientifically, the exciting news of the last few months is that a potent human immune response can come from doses as low as 30 micrograms of mRNA vaccine. So 30 micrograms, what does that mean? What it means is that this 1 liter bottle, if it were full of mRNA vaccine, would contain over 30 million doses. This is enough to vaccinate every one of Americans' doctors and first responders, or all of its seniors over 75 years old. And that is why the Obama administration invested in mRNA vaccines and therapeutics starting back in 2009. And without those investments, frankly, Project Warp Speed would not have squat. Now, Dr. Fauci, would you agree that when there are great medical breakthroughs, that the public needs to be reminded about the long line of federal R&D that's led to vaccine and therapeutic successes that we're anticipating?
Yes, Congressman, and it even goes beyond what you're saying. Everything you say is very well taken. And I think maybe it's a good time to recognize the fact that the generosity of the Congress through multiple administrations, both Democratic and Republican, and whether or not the Congress was controlled by Democrats or Republican, the support for biomedical research that goes back decades, leading to everything that you're talking about, but even before then, some of the monoclonal antibody work, some of the work that's being done with the molecules that are directly antiviral molecules. I think we often forget that when we think of the product, and often forget, as I think you've appropriately pointed out.
Well, what are the scientific investments we should be making now to ensure that we're better prepared for future pandemics? And how can we support those investments with the kind of science budget cuts that we're seeing proposed by in the Trump and Mulvaney budgets?
Well, I mean, I hope we don't get cuts, but in fact, we have been very
But they've been proposed. They've been proposed again and again. Okay.
Yeah.
Anyway, it looks like my time is up.
Mr. Chairman? Mr. Chairman, over here. Yeah, I ask unanimous consent to enter into the record story from June 5th, 2020, underscoring what Dr. Fauci wouldn't answer today. Dr. Fauci says large protests taking place across the country are a perfect setup for spreading COVID-19. So he said that a month ago, even though he wouldn't say it today. So that's a story from Business Insider, but also ask unanimous consent to enter into the record a June 12th story. Dr. Fauci tells ABC Powerhouse Politics that attending rallies, protest is risky, even though today his position seems to have changed. Obviously, his position's changed on many things, many times over the last several months. But I'd ask to enter those two articles for the record.
I'll yield to Dr. Fauci.
Like I said, any crowd, whether it's a protest, but any crowd in which you have people close together without masks is a risk. And I'll stick by that statement. It's a public health statement. It's not a judgment on why you're there in the crowd. It's a statement related to the fact that you're in a crowd.
Thank you, Dr. Fauci.
Mr. Chairman,
Mr.
Chairman, I didn't ask him a question, and you let him respond. I was making unanimous consent.
And I'm going to run this meeting.
Well, but I would like a chance to respond to what
remember,
you said.
I'm going to chair this meeting.
No, I understand you're the chair. That's why I said, Mr. Chairman.
Without objection, your statements, whatever you got there, will be entered into the record. And without objection, in a gathering, whether you're protesting or whether you're politicking, in a gathering would be risky. And that's what the man has said.
Yeah, but that's not what's happening. That's my point.
Oh,
that is
you're
not
telling
what's happening.
me
there are
that
limits. People can't go to church, can't go to work,
Mr. Chairman,
can't go
that gentleman's
school.
out of order.
But they can protest all they want.
That goes for the Democrats and Republicans. I'll make the decision as to who is out of order. I'm going to be as gentlemanly as you will allow me to be.
I appreciate it, Mr. Chairman.
Well, thank you. And with that, I'll yield 5 minutes to Mr. Green.
Thank you, Chairman, Ranking Member, and witnesses for your amazing service to our country. Thank you. First, Dr. Fauci, there was a bit of uproar about a picture of you at the Nationals game without your mask on. I think you were seated with your wife. You had a close friend there with no one else nearby you. And that gentleman who was with you had his mask on. I think you have said in the press since that you took it off to take a drink of water. I just want to point out, according to an article in the New England Journal of Medicine, and I quote, significant exposure to COVID-19 means face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal, end quote. The science seems to be pretty clear. We should absolutely wear masks when we're in close contact with those outside of our household. I think that was just the conclusion of that discussion. It's not a crime to pull your mask off to take a drink of water in 100-degree temperature when you're seated next to your wife and someone else is there. I guess I make the point to show how the media has created all of this hype, which has led to some officials across the country making decisions that are not based on science. And there are real consequences to those. I mean, if people are hot, they shouldn't get heat stroke and not take their mask off. So I'd like to move on to some other troubling actions that were done this week. This week, the chairman of the committee sent 4 letters, all to Republican governors in red states, demanding extensive documents related to coronavirus response. The White House Coronavirus Task Force report has 21 states listed in the so-called red zone. This isn't about transparency, it's about ridiculing 4 states, including my home state of Tennessee, and it distorts the truth. The letter singled out 4 GOP states, but what about the other 17 states? Why didn't California get included in the letter? They've seen an explosion in positive cases. They're in the spike. They're in the 21 listed red zone states, targeting only Republican governors when clearly 17 other states, many of whom are Democrat, are also experiencing the spikes and in the red zone, shows this effort has nothing to do with getting answers and is, as the chairman has said in his opening comments, politics over science. No scientist who wants the truth samples just Republicans. Honestly, it's a laughable partisan strike. It also compounds the insult to all Americans for the failure of this committee to look at the real culprit. As I said in previous testimony, a Columbia University study showed that 66% of American deaths could have been prevented if China had spoken up 1 week earlier. That's thousands of American lives that could have been saved. So instead of addressing the cause of 66% of our casualties, the Select Committee on the Coronavirus picks on American businesses, the Trump administration, and now 4 state governors, all Republican, when we know other blue states are in the exact same situation. This is the definition of partisanship, but I can hear it now. Didn't the right send a letter to certain governors? And yes, we did. We sent it to every single governor who refused to follow the Trump plan, emphasis on plan, and sent COVID-positive patients back to nursing homes, killing patients. We didn't select just a few of those. I applaud Congressman Foster, who approached me as a physician and asked me to join a bipartisan partnering with the administration to assist in the execution of Operation Warp Speed plan. That's how we should be functioning, that kind of bipartisan action. Finally, on a positive note, I wanted to mention the Swedish study and then ask Dr. Fauci some questions about that because I think it really illuminates some of the exciting findings in science. T cells are a type of white blood cell. They regulate immune response. The Swedish study found that many people with mild asymptomatic COVID demonstrate so-called T cell immunity to the coronavirus. The study further found that twice as many who tested positive for antibodies had T cell immunity. So we know there are tons of people out there with immunity that we aren't testing. And I'd love for you, sir, if you could comment, educate America, educate all of us a little bit on T-cell immunity and what the ramifications are to the plans. Thank you.
Thank you very much, sir. I'll very quickly try to answer. So there are 2 limbs of the immune response. One is an antibody, which is a protein that is made by the cells of the body to bind to the virus and is usually the hallmark of protection against infection. There's another limb of the immune response called the cellular immune response of T cells. And those T cells have the capability of essentially suppressing or killing cells that are infected and preventing the cells that are infected from making new viruses. So there are 2 parts of it. Even though one is generally felt to be protecting against the initial infection, the other is an important complementary. And you're right, the Swedes came out with a paper, and also a paper from NIH grantees from La Jolla just came out in the journal Cell, showing the same thing, that in individuals who were infected and recovered, they had T-cell responses, but importantly, there was T-cell reactivity also detected in non-exposed individuals, which means that maybe there's some memory from other coronaviruses that are benign cold viruses that you were exposed to that might, and I say might, explain why some people, even children, might be protected that they had exposure that's not measured in antibody, but measured by T cells. This is work that we really need to pursue. We're just at the cusp of understanding the importance of this type of response in COVID-19. Thank you.
Thank you.
Gentleman has expired, and as I yield to Mr. Raskin for 5 minutes, may I address the letter, which I have responded to. You have an answer from me. You have not seen the answer? Okay, well, just be sure, since you put the letter on the record here, let me put my response on the record. My response had to do with the 4 states that have refused to comply with the critical recommendations from the task force, and all 4 have governors who have publicly stated that they do not plan to comply. To contrast to that, we did not send the letter to those states that did indicate that they will comply with the task force, and that's 3 of those states had Republican governors, and they did not get a letter from us. So this has nothing to do with partisanship, but with the political response rather than responding to the science and our response to it. With that, I yield to Mr. Raskin for 5 minutes.
Thank you, Mr. Chairman, for calling this hearing on the urgent need for a national plan. A stack of paper is not a plan. A large and unwieldy stack of paper is not a plan. A plan is a comprehensive and coordinated strategy for victory, and we haven't seen anything like a plan. No one has shown us anything. Blaming other countries is not a plan. Blaming China is not a plan. Blaming China is not even a good excuse for the lethal incompetence and disinformation of President Trump. China's early cover-up of the disease only deepens the responsibility and complicity of President Trump, who on 37 different occasions, as I've demonstrated by submissions to this committee, defended and excused and praised the Chinese government and President Xi. A plan is a plan, and we haven't heard what the plan is, and this is what has bedeviled us from the beginning. Mr. Chairman, we've got 4.4 million cases. We lead the world in case count. We lead the world in death count. More than 153,000 Americans are dead right now. 54 million people filed for unemployment benefits. We've seen a 1/3 drop in GDP, a 1/3 drop, unprecedented in economic activity. The chart behind me demonstrates the astonishing and terrifying growth of this disease. It took us 98 days to reach 1 million cases. It took us 44 days to reach 2 million cases. It took 26 days to reach 3 million cases, and it took us only 15 days to reach 4 million cases. Director Redfield, when do you estimate we're going to get to 5 million cases? What's next?
Thank you, Congressman. I think one thing I've learned about this virus is it's not predictable. I will say one thing that's important, that what happens next is really dependent upon if the American public fully embrace what we've asked. If they fully embrace those 5 steps, we'll get control of this pandemic.
Well, I thank you for that, and I thank both you and Dr. Fauci for restating the absolute imperative importance of everybody wearing their masks when they're out in public, and everybody maintaining social distance and following the other public health protocols. But the public health officials have been subjected to harassment, and we've even seen some today, have been subjected to ridicule and have been subjected to ludicrous, absurd contradiction. So I want to go through some of the propaganda and disinformation quickly, just as a public service announcement, because America is watching you. And Dr. Fauci, why don't I start with you? Are children almost immune to the disease? Just yes or no, because I've got a lot to get through, please. Are children almost immune to the disease?
We have to be a little bit more precise. You mean almost immune. Do children get infected? Yes, they do.
Have hundreds of thousands of children been infected? Yes. Hundreds of thousands of children been infected, so children are not almost immune to the disease. Is COVID-19 going to magically disappear, Dr. Fauci?
I do not believe it would disappear because it's such a highly transmissible virus. It is unlikely that it's going to disappear.
Does wearing a mask give people COVID-19?
Does wearing a mask give it? No.
Okay.
Not to my knowledge.
All right. Is COVID-19 a hoax?
No.
Should people take hydroxychloroquine as a cure for COVID-19?
The overwhelming cumulative evidence of properly conducted randomized controlled trials indicate no therapeutic efficacy for hydroxychloroquine.
Can people cure themselves of COVID-19 by injecting themselves with disinfectant or bleach? I'm sorry?
No.
Are you safe from the disease if you go to one of the aforementioned large assemblies, crowds, demonstrations, without a mask on and not observing social distancing, if you sign a waiver that you won't sue the sponsor of the event?
I'm not so sure those things are connected, but I'll repeat what I've said multiple times, that being in a crowd, particularly without a mask, is a risk for acquisition and transmission.
Okay, so, but signing a waiver doesn't confer any kind of immunity on you from being infected by the disease?
No, of course not.
All right. Dr. Fauci, the European governments are in a completely different place. They've got the disease on the run. In fact, the Asian countries have the disease on the run. I saw some remarkable figures. Almost every other country on earth is doing far, far better than the United States, except for Brazil, whose president has followed President Trump's policies. But we have 153,000 dead. Canada, our next door neighbor, has less than 9,000. We have 17 times the number of deaths from it. China, which of course is much larger than the United States, has lost 4,661 people. We've lost 153,000 people. Our rate of death is 36 times higher than China, and on and on. Do we have the financial resources and the scientific expertise in America to do what other governments have done to bring the infection rate down to something manageable so the end is in sight of this nightmare?
I believe we do have the tools, and certainly there's been a considerable degree of financial investment.
So what is the difference? Why are all of the other countries defeating the disease and we're not? Why do we not have a plan, a strategy for victory to win, to beat COVID-19?
Well, I believe I addressed that in not only my opening statement, but also in response to the question of the congressman. And that is that when you look at the comparison between Asia and Europe, as is shown by the chairman's poster up there, that when they shut down to the tune of about 95%, getting their baseline down to tens or hundreds of cases per day. So whereas when we did it, we got it down, but unfortunately, our baseline was 20,000 a day.
All right, so we're getting somewhere, but would you agree with me that the critical difference is either the presence or the absence of social cohesion and political leadership to actually develop a plan, execute it, and stick to it?
I think there was such a diversity of response in this country from different states that we really did not have a unified bringing everything down.
Yes.
The gentleman's time has expired, but Dr. Fauci, if you'd like to add more to his question.
No, I think I just answered the question.
I mean, the end of it was essentially, do we need to stop these disgraceful attacks on public health officials?
The gentleman's time has expired. I now
Thank you.
recognize Mr. Kim for 5 minutes.
Right, thank you. Thank you to the witnesses for coming out here today. I appreciate it. I wanted to just start with a quick question to the three of you, of yes and no, if you're able to. It's a question that comes from a constituent of mine, and the constituent asked me, and I wanted to ask you, and I'll start with you, Dr. Redfield. Would you assess that our federal government, the CDC included, is doing everything possible to respond to the coronavirus crisis? Dr. Redfield?
I think we do have a comprehensive response. The one comment I want to make is the complexity is, as I mentioned before, for over 5 decades, we've underinvested in the core capabilities of public health. And hopefully we've seen now the consequence of that. So as
but with our capabilities right now, would you assess that the federal government is doing everything possible?
Within the capabilities that we do have,
yeah.
But recognizing the core capabilities have not been invested in effectively over the last 5 decades.
Okay. Admiral, same question to you. Is our federal government doing everything possible to respond to the coronavirus crisis?
It's a very broad question. I do agree with Dr. Redfield. I think within the capabilities we have, we are doing that.
Dr. Fauci, do you agree with your colleagues here? Is within the capabilities of the federal government, are you doing everything possible to respond to the crisis?
Right, I can only speak very cogently about the agency that I'm responsible for, and I can tell you absolutely that the National Institutes of Health is really doing everything they possibly can, and it's really an all-hands-on-deck approach, not only for the institute that I direct, which is the National Institute of Allergy and Infectious Diseases, but the director of NIH himself is spending most of his time right now on this, even though he's responsible for a lot of other institutes. So I think we are doing about as much as we possibly can.
Well, I appreciate that, Dr. Fauci. Admiral, I wanted to turn back to you. I just got a text message from a constituent today that follows up on this type of question, and she, Laura, says, I got a COVID test 10 days ago at a drive-up testing site and still do not have the results. And I know you mentioned before that 76% of tests are coming back within 5 days, but that also means that about a quarter of tests in this country are taking more than 5 days to be able to get these results back. So I wanted to ask you, would it be possible for our nation to have results for all COVID tests completed and returned within 48 and 72 hours? Is that a possible benchmark that we can achieve?
It is not a possible benchmark we can achieve today, given the demand and the supply. It is absolutely a benchmark we can achieve moving forward.
Now, I guess a question, so as you said, the demand and the supply. Now, the demand is something that you don't have an ability to control, but in terms of the supply, when I ask you that question, are we doing everything possible to be able to address the needs of the coronavirus crisis? What would you say to Laura here? Is the federal government doing everything that they can possibly to be able to try to get that testing timeline down to 48 to 72 hours?
I do believe we are. As we've talked about just the raw numbers of things, but we're investing in a number of technologies that will greatly expand point-of-care testing, and I think that's the future, to move more and more to point-of-care testing. We're doing that with existing technologies, with new EUAs. Dr. Fauci talked about the NIH's efforts, and I think there'll be a lot of announcements from them this morning as well. So that's where we're pointing, because point of care gives you a result in 10 minutes.
Well, I was really interested in what you said, earlier in this hearing, which was about, trying to get point-of-care testing to nursing homes and long-term care facilities. I agree with that greatly. And that feels like it's a place where the federal government is stepping up with additional resources. I'm guessing because the states have been unable to be able to fulfill something of that nature. Is that correct?
We always wanted to do that, but we did not have the physical technologies that were available. With the recent approval of a second point-of-care instrument and the manufacturing, we were able to do that. We were not, and it's literally as soon as that happened, we put that into gear. And I just wanted to correct.
What interests me about that is that this is a situation, again, where when it comes to testing, I keep hearing that, this is state's responsibility to kind of take the lead on this, but with the long-term care, it seems like this is a place where the federal government is stepping in and trying to surge resources to be able to
So this has always been a collaborative relationship, right? So the federal government buys all the swabs and tubes of media. We deliver that to the states. We buy 40% of Abbott ID Nows, deliver those to the states. We make affirmative actions for nursing homes because that's where 40 to 50% is. And everything else is really a collaborative interaction. There's part state, there's part federal. We really do work together on that. We do not defer everything to the state. If we did, I wouldn't be spending 24/7 with a team of 50 people since March 12th.
Great, thank you so much. My time has expired. Yield back.
Thank you. Without objection, I would like to place 2 reports into the record. One is from Forbes, and it's entitled, "Researchers say protests did not increase COVID-19 spread, but Republicans are still blaming them." This is one report. And I have in my hand here, I have a report and a study from the National Bureau of Economics Research that was published last month. And this study found that there was no connection between Black Lives Matter and protests in recent months and increased spread of the coronavirus. So without objection, I would like to place both of these studies into the record. We will now go to a second round of questioning. I'd like to ask the panelists, would you like a 5-minute break before we begin the next line of questioning? Yeah, okay, so we are taking a 5-minute break, and we will be back in 5 minutes for more questioning. Thank you.